Well, good morning, Carol Johnson.
Good morning, Bob Ponce. How are you?
I'm good. I'm good. So, we are here for our weekly COVID-19 update special report. And I guess the report for today is what we talked about 2 weeks ago, which is that there would be a surge after Thanksgiving. And lo and behold, I'm afraid it's here.
Yeah, again, it just boils down people not getting it. I
Hmm.
think too many people out of fear, you know, people can face everything or they can sort of forget everything and run. And what is it? False evidence appearing real. Fear is a motivator. It can motivate
Hmm.
you to act or it can motivate you to not act. And
Hmm.
obviously, people are not taking this seriously. I'm hearing too many people focused on how many people had COVID and recovered. They only know the people that did not die from this disease, but they
Hmm.
are far from recovered.
Yeah, that's right. I mean, we're seeing more and more about the long-term effects every day. But let's just talk about what the numbers are now. So we're talking about nearly 200,000 new confirmed cases a day over the last week. We're talking about 2,200 people a day dying on average. And we're talking about 102,000 people hospitalized in this country. It's at the highest level of the pandemic. So
Yeah.
that, I mean, it's just crazy that amount that 2,200 people a day is it's unbelievable. It's it's over. It's like what is that? Like 15 or 16,000 people a week.
Yeah, and
Mm.
Fauci said that if people didn't hanker down, and this came a couple of weeks ago when we began to report this surge that was coming. We don't
Mm-hmm.
have two balls. It was just inevitable
Mm-hmm.
that you know they expect that at that time it was 284 people dead, 284,000 people dead, and they said then they expected that number to double and possibly triple by the new year. And with these numbers, that is a strong, strong possibility.
Mm-hmm. And in addition to the surge in COVID, there still seems to be a surge in stupidity because you still have some of these states where people are openly, blatantly disregarding, doing social distancing protocols, and wearing masks, and there are states where people are openly um, um, fighting against it. I saw something yesterday where in Colorado there's a county where the governor gave orders for wearing masks, and the county rejected it. They said they're not going to follow these orders, even though COVID is shooting up in this area, and it's crazy. You see what's also going on in Florida with Governor DeSantis down there, who literally has waged war against one person who has been making sure that the real numbers for Florida get out. She was the woman who was responsible for setting up the tracking for Florida, and then she resigned because she saw that they were cooking the numbers and started putting the numbers out on her own. And then let's see what happened yesterday. She was what happened? The Florida officials came in, raided her house, and took her computers. And she's like, "That's not going to stop me. I'm just going to get a new computer." So it's interesting the levels that people are going to go to just deny what's going on. It's really really crazy.
Yeah, we stopped trying to make sense of it. We just call it what it is. It's just plain evil.
Mm-hmm.
You know, um, as Stop the Bleed, both Bob and I Stop the Bleed instructors, and they say that a worse than someone dying is a death that could have been prevented.
Mm-hmm.
And that's the motto now.
Mm-hmm.
Uh, and that's what's happening here. You know, deaths that could have been prevented, and hundreds of thousand deaths that will take place that could be prevented. And you've got heads, you've got your leadership fighting.
Mm-hmm.
I'm trying to wrap my head around a story. Where was it, in Ohio? I have to pull it up. The doctor refuses to wear a mask.
Mm-hmm.
And
Oh, it was Oregon. It was
Oregon,
Oregon. Yes, yes. The doctor was a Trump doctor. He refused to be a mask. He was speaking at one of these rallies about stop the steal nonsense. So he's fully drinking the Kool-Aid. But can you imagine he's treating people and refuses to wear a mask and is going out loud and proud about how he wears a mask and don't wear a mask. It's tyranny and this other nonsense.
well, this is another one. This is a woman who's actually working in the hospitals with patients, with
Mm-hmm.
COVID patients. And she did a press conference, and she absolutely refuses to wear a mask. And anyone who allows this woman to come within 30 feet of her, as soon as she appears in your doorway, preferably if you're not too sick to attack, I would grab anything I can and aim it at her head. You are getting out of this room. You
Mm-hmm.
fight for your life, and you've got a woman who is a medical professional refusing to wear a mask. And what I don't understand is how the administrators have allowed this.
Mm-hmm.
So it just goes to show how evil this thing really is.
Well, it's funny. I mean, I have a friend who actually is a doctor who runs a hospital in Colorado. And I had a conversation with her about this whole thing. And she's like, I just don't play that. And when people come into her hospital talking that nonsense about not wanting to wear masks, it's like, look, you can get your health care somewhere else. Everybody is following these protocols or else. But that's when you let a black woman run things, they run
Okay.
things.
Homie, don't play that.
Yeah, at all, at all, at all.
I
Well,
don't understand this.
mm-hmm,
And the doctor at Walter Reed Medical Center was mysteriously relieved of his duties. That's the doctor that was outspoken about Trump leaving and infecting the people
oh,
who are
really?
always living around,
Wow.
in the hospital, strolling through the corridors and leaving his germs behind. He
Mm-hmm,
spoke out about it was the most irresponsible thing for him to do to take a photo op. He has
mm-hmm,
been relieved of his duties. And the interesting thing is, in reading the story, all of these administrators, nobody can kind of quite figure out who did it.
mm-hmm.
What happened?
We know who did it.
I'm like, if I have to go back to who hired me.
Hmm, that's crazy. So here in New York, Governor Cuomo has directed the State Department of Health to begin implementing surge and flex hospital protocols, which means that all the hospitals are mandated to expand their capacity by 25%, and certain regions can be designated as red zones if the hospital capacity is projected to become critical. They're also New York is also asking retired doctors and nurses to return to service, and their registration is automatically renewed. Their fees are waived. Please, please come back. Um, they are looking at closing indoor dining in New York City, and they're probably going to look at it over the next 5 days. And if the rates don't stabilize, we could see indoor dining closed down. So, which is a tough one for obviously for these restaurants have been back and forth, but it's tougher still if people are going to be exposed. So if you're planning, I don't think anybody should be planning on doing any dining out, but if you're going to do it, you better do it the next couple of days because, you know, within 5 days from now, they may be shutting dining down again. And we're looking at 4,600 patient hospitalizations statewide right now, 872 in the ICU, 477 are intubated, and the statewide positivity rate is 4.79%. You know, we've been talking about that rate. It's been jumping up, you know, week after week. And there were 80 COVID-19 deaths in New York State yesterday. So it's here. And as bad as it is here, it's crazy worse in the rest of the country. The irony is that a lot of those people who left New York City in the springtime because, oh, I can't be here, it's COVID, are now at some place where the COVID rates are much higher than they are here. So you can run, but you can't hide.
That is absolutely true. You know, it's just really, really sad how excuse me. You know, we were talking a couple months ago about it going over 1%.
Mm-hmm.
And all the things that would happen, the shutdowns that would begin. And I just believe that those things should not have opened. That's all part of this real surge here.
Mm-hmm.
That they should have remained closed.
Mm-hmm.
You know, a lot of the other countries that shut down, they're bringing it down.
Mm-hmm.
They're bringing that curve down. And that's because they're demanding that everything's closing. Restaurants, movie theaters, gyms, all of that. And it's back to they're actually in the real lockdown phase that we never really went into. Because if you remember when the governor was first saying, okay, he wouldn't call it shelter in place. See, that's what disturbs me about these people. They refuse to use certain catchphrases. And so they won't use the word cluster when all those clusters were already building in Queens, Brooklyn, and Staten Island.
Mm-hmm.
But it was a cluster in Westchester.
Right.
In the very beginning. But he said, I don't want to use the word cluster with the people in Brooklyn. Okay.
Mm-hmm. Mm-hmm.
And meanwhile, it was surging, and look at it now.
Mm-hmm.
And when you look at how many people were allowed to still go out and go to these different places that they kept opening up, you started to see it come back. And all of the health professionals across the country was like, we really shouldn't open so soon.
Mm-hmm.
And we open later than those other states that are surging, that are hemorrhaging now.
Mm-hmm.
You know, but we live in such a condensed area where it's difficult to socially distance. And that's why it should have remained. That mandate should have stayed. Shelter in place, only go out for essential reasons.
Mm-hmm.
Now, I know businesses have to suffer, businesses will suffer, but the bottom line is the businesses will not suffer the way human beings will suffer.
True.
And those business people, those business owners may not survive this either. So I've yet to see a dead person operate a business. I mean, for real. I haven't seen that yet. If you have, send us an email. But and I think that's it. I think it was irresponsible. So everybody knows that like America is now like, we don't want you. No, nobody wants us. No country wants us to come there.
Yeah. It's crazy.
And excuse me, just 1 second. And then there's some countries that you can't even come in. You cannot come into our. Matter of fact, it was the airlines, I believe. You can't even get on our airlines unless you receive a vaccination. I just checked before I told you I was 18 million. Now I'm 20 million.3 on the possibility of getting a vaccine. So they're saying
Mm-hmm.
if people have not vaccinated, they do not even want them on their planes.
Mm-hmm. Which doesn't make sense because there are people who have had it, who have the antibodies, who are safe from it at least for a measured period of time. That should be a criteria as well. And there are obviously uh, people making different noise about trying to connect vaccines to travel and things like that, which I think is a dangerous, slippery slope. Here's another story where they're talking about some former congressman who came up with this proposal that trying to tie another stimulus check to, in order to get the check, you have to get a vaccine. And I just think that it's a dangerous precedent because it requires people to make a decision between making a decision on their health and getting money that they need. The money should come with no strings attached. I believe there are people who may, for good reasons, based on their medical conditions, which everyone is different, decide that they don't want to take the vaccine, and they should be able to do so without having to have basically bargain with it for stimulus money. But
Yeah, it's a con job. It's
mm-hmm,
a con job.
mm-hmm,
And
along
they
with
know that people will jump at money. I mean, look at how many people went into the polls thinking that they was going to get the stimulus check when Trump said, no stimulus until after election. If I lose this, you're not going to get a stimulus check. You had people literally switching parties to get a stimulus check.
mm-hmm,
It's another con game.
yep,
Whatever you do, we asked you even last week, the week before, please be responsible in the choices that you make where this thing is concerned. Find a
mm-hmm,
doctor.
mm-hmm,
Talk to a doctor. If you have one, talk to them. If you don't have a doctor, talk to a friend that has a doctor and see if they can hook you up with being able to go on a telehealth call with a medical professional.
mm-hmm.
This is it's really that bad. There's so many games being played out here, and it's the game of life that like I pretty much think we all want to stay in.
Mm-hmm.
You have to really, really weigh these circumstances very, very carefully.
Right, right. Now, there was also a story that I'm going to bring up here that this was reported by NPR that corona was in the U.S. weeks earlier than previously known, according to a study. And so what's happening is that they've been studying and looking at different, I guess, blood samples for people who gave blood, and now they're finding evidence. They're finding antibodies going back as far as December 13th, and that was way before it was supposed to have gotten here. So there's some evidence that the virus was already spreading around the world before health officials and the public was aware. And it also, they're not really mentioning it, but it also um, makes one question whether the storyline about it coming from China were true. If it was already here in the U.S. in December, maybe it did come from China earlier, or it maybe came from somewhere else. So every week there's more and more information and evidence about this disease, but it's some of the interesting stories that don't get the headlines. There's another one we talked about, which is saying that sickle cell disease was tied to worse COVID-19 outcomes. And so, again, one more factor that creates comorbidities for Black people from this disease. So having sickle cell can put you more at risk for hospitalization, pneumonia, and the pain associated with COVID-19. according to reports from the Medical College of Wisconsin.
Yeah, when I read that, I kind of got a chill up my side because, I'm a sickler.
Mm-hmm.
But, I don't let things scare me,
Mm-hmm.
especially when I know that I'm doing the best. We've come a long way. There was a time when people with sickle cell didn't live really past the age of 25. You know, we got people living into their 70s
Mm-hmm.
now. And just like myself, if you really focus on taking care of yourself, as we've been talking from the beginning of this programming, you know,
Mm-hmm.
um, about tuning your immune and just
Mm-hmm.
being careful. I guess
Yeah.
I'm really blessed in a way at this time to live by myself because I don't have to worry about other people coming in and who's leaving what's, in my home, it's
Mm-hmm.
that I just have to follow behind myself,
Mm-hmm.
and just stay on top of things and, make sure that, I talk to my doctor and I get, my checkups. And when no, you just got to know your body when you know something is out of whack. And some
Mm-hmm.
things happen with aging, but
Mm-hmm.
when something is just not right, just pay
Mm-hmm.
attention to, your health. Stay on top of it. I suggest that everybody, get there's a port that mostly all hospitals and medical facilities have, and it's a patient portal, where you can pull up your personal information. If there's anything that's confusing or concerning, go back in there, look at that. If there's something that you see that's out of whack, because sometimes things are not quite in range, but the doctors don't say anything to you. You can go back and you can look at the test that's been done. Certain testing needs to be done like every 3 months. You check that. When was the last time you had that done? You might need to run in there and do a physical now before things really start to lock down and they get worse.
Mm-hmm.
Get that checkup, and just take care of yourself the best that
Right.
you can.
Right. Um, we say it. We've been saying it, but it's really now more important than ever to do everything you can to not show up at the hospital because we were concerned about hospital system being overwhelmed back in the spring, and it really obviously it was very very hard hit here in New York City. But we're actually looking at conditions now that can be potentially worse because the entire hospital system all throughout this country is being pushed to the limit. And so the resources are just going to be stretched. You really don't want to be in a hospital, and not only just for COVID, but for any reason. So it really now is the time to really boost your immune system, and it's not just for COVID. You don't want to catch the flu. You don't want to be in the hospital for any reason if you don't have to. And the only way you can avoid that is to generally boost up your health. So it really means eating better. I think that's really the focus and center of health is what are you eating? If you're eating a lot of um, you know white sugar, white starch, those things, they all contribute to the factors that start to um, detune your immune system. Um, and we talk, we say it, and we'll continue to say it. Vitamin D levels are so important and critical. Vitamin D, it's really an amazing nutrient that, according to doctors, connects with over 1,000 different body processes. It is kind of the band leader when it comes to your immune system, and because African Americans have a tendency to have low vitamin D levels in the winter months, As you said, when you're going to your doctor, you should be asking them for, to test your vitamin D levels. It's a simple test. It really should be part of any checkup, but sometimes it's not. But if you're black, if you're a person of color, you should always have that checked. Vitamin C should be something that's in your diet every day, because vitamin C does not stay in the body. It's water soluble, so whatever is not used goes out in your urine every day. So you have to continue to refresh your vitamin C, whereas vitamin D is something where you have to build it up over time, and so you want to be building it up in the winter. We talk about zinc, and the reason zinc is important is because it's been shown by the National Institute of Health to inhibit viral replication. Literally, when zinc gets inside of your cells, it stops the virus from replicating. And replication is what causes the damage when viruses go crazy. It's not the virus itself, because your body has been dealing with viruses since you were born. But when the virus gets out of control, that's when it creates conditions in your body where your body has to respond to it. And your body's response to it is often what is causing the damage that ultimately leads to hospitalization and potentially death. So you want to do everything you can to get your body systems up and working. And the one that we started talking about last week, which was just new information, is melatonin. And we'll say it again, that there was a study by the Cleveland Clinic, which is a very reputable institution, one of the most reputable in the world. And they analyzed the data from their COVID-19 registration, and they showed that melatonin usage was associated with a nearly 30% reduced likelihood of testing positive for the SARS-CoV-2 virus, which is the virus that causes COVID-19. But that's not the real kicker. The real kicker was when they adjusted the data for African Americans, the reduced likelihood of testing positive increased from 30% to 52% when adjusted for those same variables. So that's really some strong evidence that melatonin is really doing something. And yeah, a lot of people just know it for sleep aid, but it definitely, according to this information, can have a positive result in protecting you from getting the virus. So I'm sure there was those that said, well, that's not enough information and you need more. But you know what? The things that we've been talking about, vitamin C, vitamin D, melatonin, zinc, these are things that are available over the counter. The reason they're available over the counter is because they're generally considered safe in the dosages that they're sold in. And so everybody obviously has to evaluate these things according to their own biology and their own medical history and all that. But these are things that you can do as a preventive measure to build up your body's immune system, so that if COVID tries to knock on your door, your body can say, we're not we're not here. We're not accepting visitors right now. So
right. No bueno. No bueno.
Yep.
This just in, a very interesting tidbit from one of our
Mm-hmm.
colleagues. After 9 months, mainstream TV, MSNBC is finally using your script, meaning
Mm-hmm.
our script, about using vitamins and how to
Mm-hmm.
quarantine at home. Actually, they just touched on it. It is nowhere as detailed as what
All
you
right.
all have been
Well,
doing.
yes, thank you.
Thank you.
We appreciate that people
Thank you.
somebody's listening. We know a lot of people are listening to us, not as many as should, and we do wish that mainstream media had really jumped on this. But the problem with vitamins is that vitamins don't make the kind of money that these other drugs do, and so there's no advertising budget. There's no real push behind getting these solutions out there. So we're not concerned with that. What we're concerned about is that people give themselves the best possible opportunity for them to survive this virus. And, make no mistake, with all the bad news, people do survive. But not only do you want to survive, but in what condition do you want to survive? So that's the thing, is that it's not just about survival. It's about what happens in the road to recovery. The one thing that we've learned since, we learned a lot in a short period of time in March and April. And we spent a lot of time starting really in February looking at the science that we would have enough information to share with people. And I'm not ashamed to say that we've been right about just about everything. But the thing that we did not know anything about is what about the long-term effects. And so, week by week, month by month, we've been seeing more and more reports about the different long-term effects of this virus. And we'll probably be learning about this stuff for years to come, just what those long-term effects are. And so the best thing is that you want to protect your body so that you're not having to experiencing these things personally. And it really is about boosting your immune system. I've been seeing a lot of things that suggest that focusing on things that reduce inflammation in your body, focusing on antioxidants, really help your body to respond much better. And those things are not only important for COVID, but they're important for all of the major diseases that we face. Can be improved by reducing the inflammation in your body. So I would, as you start to look about your own health, those are places to look. And so, I, personally, go way beyond vitamin C, vitamin D, and zinc, selenium, magnesium. There are so many things. There's so many food supplements that you can take, turmeric and ginger, and there are different mushrooms that have great healing properties. And there are so many things that if you start to take time to look at those things, you can recognize that there are things you can do to help your body do what it was naturally designed to do by the Creator, which is to be healthy. So we're about health. We're not here every week to scare people, but we have to give you the information straight. And so the information can be scary because we're dealing with two different levels. We're dealing with the virus itself, which is something that can be dealt with science and with changing your habits. And then we're dealing with a whole group of people who refuse to do so, which is making the virus that much worse. And so I don't know what the solution is for that part. We can figure out how to deal with the surge, but the stupidity, I don't understand it. And I don't have any answers for that.
There are no answers. We would drive ourselves crazy if we were trying to find an answer for just ignorance and stupidity. It's like another game of cat and mouse. How early on people were actually playing games with this thing to the point where they were having COVID parties and piling a lot of people into a backyard or a large room and giving cash prizes to whomever got it first. And even now, right here in New York City, where 400 people gathered last week, 400 unmasked, no socially distancing. Well, if you're not wearing a mask, you're not going to socially distance. And they got together, and these are supposed to be relatively intelligent, well-read, educated people. And they got together at this event. And I mean, if you're not going to socially distance and you're not going to wear masks, when the alcohol starts to flow, you're going to get even more lax. And there goes the hugging and, kissing everybody. Like, kiss me, I'm Irish. You just start hugging everybody and just become totally irresponsible. And there's been a couple of groups here in New York that have gathered, clubs that have been busted, where people are so willing to get together in a warehouse with no liquor license and pile a truckload of people in there. And my thing is, if that's what people want to do, I can't stop them. But you got to use your better judgment and stay home.
Mm-hmm.
We're talking about the surge that we have not yet seen yet. We've seen the beginning of the Thanksgiving, the post-Thanksgiving surge. And now we're going into Christmas and the New Year's.
Yeah.
So
We're just going to close out by saying the same things we were saying about before Thanksgiving. Unfortunately, they're even more true for Christmas. So people really have to make some really tough decisions about what you want to do and how you want to spend this holiday. But we recommend it's not the time to socialize. Listen, do 12 days of Christmas. You have your Christmas 12 days later when people aren't moving around.
right.
Have it in small gatherings. Don't do a whole lot of traveling, and stay away from public transportation during those days. It's not a good look.
And I don't know what they're going to do with New Year's. Is there a ball dropping at Times Square this year? If it drops, make sure you're at home watching it.
I don't think they're dropping a ball. I don't see any way that's going to happen. I'm number one. It's against everything they're saying about gathering. So, and that would be the super spreader event of all times, is to have a Times Square ball drop. So, yeah, that's 2020, baby.
I mean, really, but everything keeps, they keep pulling back on things. That's the thing. It needs to be decisive.
Mm-hmm.
Not going, just say what you mean and mean what you say. Just do a lockdown.
Mm-hmm.
Just do a lockdown. Leave the kids home. All the money that they're spending to sterilize a school and open it for 2 days and find 4 or 5 people positive, they got to close it down and sterilize it again and open it up 5 days later. The millions of dollars that's being spent there, you could take that money and pay those parents to stay home.
Mm-hmm.
Let them be their own babysitters. You used to have babysitting services with the city. People that would take maybe 4 or 5 kids and babysit them while people were working. Pull that service back. Let them, the parents, stay home. Now we don't know what's going to happen with the stimulus. That's not going to be enough anyway. But the same way welfare managed to give each kid an extra $480 something a month to eat, put some finances, some of that money into the homes so that these kids can stay home. Because that whole testing system was crazy. People, obviously, this is just obvious. If you're randomly testing people coming into the school, randomly testing staffers and students, obviously, the ones that you randomly let go in were the ones that came in with the disease.
Mm-hmm.
So you cannot randomly test anybody. That didn't make sense to me from the beginning. Leave the schools closed. Don't even think about it. Think about getting free broadband, which we can do in New York. Free broadband across New York so that these children can learn. Teach the students remotely. Teach the educators how to operate the programs. You got all these kids with tablets and no internet service.
Mm-hmm.
It's not a major deal to get internet into people's homes. And the city sure has the money. Invest in your people so that they can stay safe.
And the city needs to keep accountable companies like Verizon that actually promised to have FiOS in every home in New York City by 2014, and it's now 2020. And the city, you know, their agreement actually expired, and so you know, we can't afford to just let companies make promises and not keep their promises. And now, in our hour of need, we don't have the bandwidth that we basically paid for. You know,
Right.
so so that I think that's all we have for today. Again, people stay safe, you know, practice safe, look out for each other, and that's how we're going to get through everything.
Absolutely. So
Hmm.
everybody do the best you can. Stay safe. Stay home if you can. Um, and remain hopeful. Remember all the things, you know, exercise, walk around your house, make sure you get some exercise,
Right.
rest, even if you don't sleep, lay down, take a break, get off of social media. You know, don't spend all day on social media just reading a whole lot of craziness, you know.
Hmm.
Um, take some time for yourself, meditate, pray, do whatever you have to do to remain sane. Because when this
Hmm.
is all over, a whole lot of us gonna have to get that checkup from the neck up. It's gonna drive people crazy if you let it. But if you
Hmm.
just listen to some simple facts, and especially the medical and scientific facts,
Hmm.
you know, don't listen to other stuff where, you know, people don't have medical degrees, but they can't even pull up any articles. They can't pull up any thing like the stuff that we're bringing you where we can show you where to find this information.
Hmm.
There are people that's, you know, they make up things as they go along and you want to believe it out of fear. Please don't. Just use some logic, you know, some good common sense,
Yeah. Yep. Use some grandmother level common sense.
you know, old
Yeah.
mother's wit.
Exactly. And
Yeah.
and also remember where we came from, because the thing is, here in New York we did flatten the curve. We did go through this before anyone else did, at a level that no one else did, and we brought the curve down. Now it's going back up again because of behavior, but it's not as bad as it is in other places, because we have enough people who knew what happened and don't have to be convinced that something is going on. And so you have to make sure you get your information from trusted sources. Don't believe everything you say. Look at everything, but look at where the source is coming from. Is it trusted? Is it worthwhile? Or are they just pushing an agenda? And you know, we don't push any agenda. We just try to look at the facts, and we're not pushing anybody into any scenario except the ones that we know that has science behind it. And so everything we've talked about, someone asks us, I can tell you the doctors, I can tell you the studies, I can quote that information, I can send it to you if you're interested. If you want to know more about it, you know, we have our information on the screen. You can send us an email or drop us a phone message, and we'll give you that information. So um, uh, come back next week. We'll have more for you. Meanwhile, stay safe.
Take care, everyone. Be well.